nerve supply of the eye, which include the ocular and sensory and the parasympathetic nerve supply to the eye. So this will be discussed in the first lecture, while the second lecture will be discussing the visual pathway of the eye. So here is we will discuss today the motor cranial nerves, or the ocular cranial nerves that supply the motor supply of the extraocular muscles, including the oculomotor nerve, the trochlear nerve, and the abducent nerve. And also we have other nerves that have mixed supply, so they supply both motor and sensory, like trigeminal and facial nerve, in addition to the parasympathetic component of the facial nerve. So this will be discussed in the first lecture, and together with the autonomic nervous system, which is the parasympathetic and sympathetic. The second lecture will discuss the visual pathway, which consists of the optic nerve, starting from the optic nerve, the optic chiasma, the optic tract, lateral geniculate body, radiation, and finally the visual cortex. I don't think that we will have time to discuss embryology today. So if we didn't find time, or if you are already saturated from the lecture, we will discuss the embryology tomorrow in the same time. So I will just join you from my mobile so that I can keep up with your questions. So here we go. Okay, so what are the cranial nerves? We have, as you know, that we have 12 cranial nerves. These cranial nerves are the olfactory, the optic nerve, the oculomotor, the trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. So they are divided along the brainstem, which consists of three main parts: the midbrain, the medulla, the pons, and the medulla. So which of the cranial nerves are lying in which part of the brainstem? So we have the first part, which is the midbrain, which is occupied by two cranial nerves. They are the oculomotor and trochlear. While the next group of cranial nerves are occupying or emerging from the pons are the trigeminal, abducens, facial, and vestibulocochlear. So these are the cranial nerves whose nuclei are present in the pons. And the final fourth cranial nerves, from the 8th to 12th, their nuclei are located in the medulla, and they emerge from the medulla. So this is like an anteroposterior section. If we take a side section or a side view, we will see the same picture. So here we have this green structure is the midbrain. The midbrain has a superior collicus, in which the nucleus of the third nerve occurs or occupies. There is below the superior colliculus, there is inferior colliculus, from which the trochlear nerve emerge. Then we have the pons. Here is the pons. The pons, there will be fourth cranial nerves emerging from the pons. It will be the trigeminal, the abducens, the facial, and the vestibulocochlear. And finally, the last group of the cranial nerves, the glossopharyngeal, the vagus, the accessory, and hypoglossal nerves are emerging from the medulla. So let's start first with the ocular motor cranial nerves, which control the extraocular muscles. First of all, the oculomotor nerve. So for each cranial nerve, we will study the nuclei of this cranial nerves, whether it is motor, it is sensory, it is parasympathetic as well. And then we will study the course of the cranial nerve, know what are the important anatomical features throughout the course of this nerve. Then finally, we will come to the final branches of the nerve, and we will get to know what are the structures that are supplied by this nerve. So starting with the oculomotor nerve. Oculomotor nerve has a motor nuclei and a parasympathetic nucleus. So where it is located? it is located at the upper level of midbrain. So it is located at the level of superior colliculus. As I told you, the nuclei of the oculomotor nerve are divided into a group of nuclear complex which give rise to the motor nerves that supply the extraocular muscles. And we have the Edinger-Westphal nucleus, which have the which share in the parasympathetic supply of the eye. So here is the Edinger-Westphal nucleus. As you can see, it is a paired nuclei. So there will be one on the right and one on the left. Both are located in the midline. And their function is to give a parasympathetic supply to the ciliary ganglion. So ciliary ganglion, it is a parasympathetic ganglion which receives its a preganglionic parasympathetic supply from the Edinger-Westphal nucleus. Visual pathway, or sorry, the light reflex pathway is this is the efferent pathway that share in the formation of the light reflex. So the light reflex pass in the both in the preganglionic parasympathetic to the ciliary ganglion. Then we will have the nuclear complex. The nuclear complex are different groups or heterogeneous groups of nuclei that supply the extraocular muscles. They are divided into the central subnucleus. It is one subnucleus that gives bilateral supply to the levator palpebrae superiosus muscle. So both bilateral levator receives their nerve supply from the central subnucleus. This means if we have a lesion that will damage the central subnucleus of the third nerve, this will lead to bilateral ptosis. Then we have a group of the medial subnucleus, and this medial subnucleus will supply the superior rectus. But bear in mind that it will supply the contralateral superior rectus. So here is the right medial subnucleus will supply, as you can see here, the left superior rectus muscle, while the left medial subnucleus will supply the right superior rectus. Finally, we have the lateral subnuclei. These are a group of nuclei named together the lateral subgroup, which are supplying the remaining muscles supplied by the third nerve. So they supply the medial rectus, the inferior rectus, and inferior oblique. So here, the medial rectus, the inferior rectus, and the inferior oblique muscles, all these muscles are supplied by the lateral subnucleus group present on the same side. So again, Edinger-Westphal nucleus, they are paired nuclei in the midline. Each side will give rise to the parasympathetic supply to its side, while the central subnucleus will supply the levator muscle on both sides. Medial subnucleus will supply the superior rectus on the contralateral side. Lateral subnuclei will supply the medial rectus, the inferior rectus, and the inferior oblique on the ipsilateral side. So here what we have just mentioned. Nuclear complex will supply the levator, it's unpaired, supplying both levator. Superior rectus will supply contralateral superior rectus, medial rectus, and inferior rectus, and the inferior oblique are supplied by the ipsilateral lateral subnuclei group. While the Edinger-Westphal nucleus, it is a paired subnucleus that supply the preganglionic fibers to the ciliary ganglion. So what happens after we know the nuclei of the third nerve? Then we get to know the parts of the third nerve. Each part of any cranial nerve starts by a fasciculus. A fasciculus meaning that it is the part of the cranial nerve within the brainstem before it enter into the intracranial cavity. So the part of the third nerve as it passes through the midbrain, it is called the fasciculus, which has 3 stations. It first passes through the red nucleus, then pass into a blackish area called substantia nigra, then arise from the medial aspect of the cerebral peduncle to reach the interpeduncular fossa. Here we have the oculomotor nucleus arising from here at the level of superior colliculus. This is posterior or what's called dorsal, and this is anterior, which is called ventral. This is the section that we took. And here you can find that the oculomotor nucleus will give the fascicle. So the fascicle will first pass through the red nucleus. After leaving the red nucleus, it will pass through the blackish area called substantia nigra, and finally it will emerge from the medial aspect of the cerebral peduncle in the fossa between both cerebral peduncles called the interpeduncular fossa. Then it will enter the cranial cavity. Again, here is a side view of the third nerve. So you can find here is the third nerve group of nuclei passing first through the red nucleus, then the substantia nigra, and finally it emerges from the brainstem in the interpeduncular fossa between both cerebral peduncles. Then we have the basilar part. So the basilar part is the part between them and the brain and the cerebral cavity. So it is the part in the cavity or in the space between the brainstem and the intracranial cavity. So this is called the basilar part, and it starts at the medial aspect of cerebral peduncle, as we know, and then they pass between the posterior cerebral artery and the superior cerebellar artery, lateral to the posterior communicating artery. This slide is of extreme importance, is of paramount importance, because it is frequently asked in the exams, either basic one or clinical one, because it has an important clinical aspect. So here is the third nerve, oculomotor nerve, as it emerges from the red nucleus, substantia nigra, and the medial aspect of the cerebral peduncle. It will pass between Then it will pass between the superior cerebellar artery, as you can see here. So it is lying above the superior cerebellar artery and below the posterior cerebral artery, and it passes lateral to the posterior communicating artery. So here is the third nerve, and here is the posterior communicating artery. So what is the clinical importance of this relation? This occurs, or the important clinical aspect of this relation is that if we have an aneurysm that arises from the posterior communicating artery, it will be in a close proximity to the third nerve. So it will compress the third nerve. So what will be the problem, or what will be the clinical features of this compression? We have here is the posterior communicating artery aneurysm compressing on the third nerve. As we can see here, here is the posterior communicating artery has an aneurysm compressing on the third nerve. So the clinical feature of this aneurysm, that it will cause compressing the superficial part of the third nerve, and the pupillary fibers that supply the pupil, or the parasympathetic supply that supply the pupil, is passing superficially within the third nerve. So if there is an aneurysm that's compressing the third nerve, this will lead to compression of the pupillary fibers running superficially in the third nerve, causing affection of the parasympathetic supply to the eye. So what is the action of parasympathetic to the pupil? It will cause constriction or will cause meiosis. So if we have a posterior communicating artery aneurysm, this will damage the pupillary fibers, leading to mydriasis. So this patient will have acute onset of dilated pupil. So if the patient has a third nerve palsy and dilated pupil, this means it is called a surgical third nerve palsy, which is an emergency. This patient should receive MRI and MRA to know where is the pathology, which is most probably will be located in the posterior communicating artery. So this patient has a risk of death from bleeding of this aneurysm. So this patient should be admitted and surgically treated to avoid rupture of this aneurysm. So here is the posterior communicating artery compressing on the superficially located pupillary fibers within the third nerve, causing pupillary dilatation. However, for other, can you hear my voice clear? Okay. Okay. So back to the slide. If we have the a or a medical causes of the third nerve palsy, like for example, if the patient has diabetes or hypertension, these vascular diseases will cause occlusion of the vasa vasorum, supplying the nerves, the blood vessels that will cause supply of the nerve. These blood vessels will supply the center of the nerve. So if we have a medical disease, this will cause affection of the central fibers, causing sparing of the pupillary fibers located superficially. So these patients will have a third nerve palsy, but without pupil involvement. So pupil involvement is an important clinical sign to differentiate between surgical third nerve palsy and medical third nerve palsy. Then after entering the cranial cavity, the third nerve will enter the cavernous sinus. As we said in the blood supply lecture, so the third nerve will enter the lateral wall of the cavernous sinus above the fourth cranial nerve, and this relation will be reversed at the end of cavernous sinus, as we will see later. Then, after leaving the cavernous sinus, in the cavernous sinus, the third nerve will be divided into superior and inferior divisions, which will enter the orbit through the superior orbital fissure within the annulus of Zen. So here is the oculomotor nuclei present in the midbrain. Then it will pass the vesicle and the basilar part, and then the intercavernous part, entering the lateral wall of the cavernous sinus. Then it will emerge from the cavernous sinus by division into superior division and the inferior division that will pass into the superior orbital fissure within the annulus of Zen, as we said in the orbit lecture. Then it will divide into superior division and the inferior division. The superior division will supply the superior muscles, so it will supply the levator palpebris superiosus muscle and will supply the superior rectus muscle. On the other hand, the inferior division will supply the inferior groups of muscle, which are namely the medial rectus, the inferior rectus, inferior oblique. Also, the inferior oblique will give a twig or will give a parasympathetic supply to the ciliary ganglion. So the nerve to inferior oblique will carry parasympathetic fibers arising from the Edinger-Westphal nucleus and passing along the course of the oculomotor nerve through the main trunk, then the inferior division, then the inferior division, then the nerve to inferior oblique, then it will supply the ciliary ganglion. These are the preganglionic, and after this the parasympathetic postganglionic fibers will pass with the short ciliary nerves to supply the constrictor pupillae muscle and the ciliary muscle. So here is the interorbital part is divided into the superior division supplying levator and the superior rectus, then the inferior division supplying medial rectus, inferior rectus, and the inferior oblique. Then the parasympathetic preganglionic fibers will pass with the nerve to inferior oblique to the ciliary ganglion, short ciliary nerves, constrictor muscle, and ciliary muscle, while the sympathetic postganglionic fibers, as we will see at the end of the lecture, pass with the nerve to the levator palpebris superiosus to supply the molar muscle or the superior tarsal muscle. So again, here is the trochlear nerve arising from the ventral surface of the midbrain at the level of superior colliculus, passing into this is the basilar part, then will enter the cavernous sinus, then it will enter the orbit through the superior orbital fissure within the annulus of Zen to divide into superior division and the inferior division. The superior division will supply the superior rectus and the levator palpebris superiosus, while the inferior division will descend downward to supply the inferior group of muscles, specifically the inferior oblique muscle and the inferior rectus muscle and the medial rectus muscle. Also, from the nerve to inferior oblique, it will give parasympathetic supply, preganglionic supply to the ciliary ganglion. Here is the oculomotor, and here you can see the parasympathetic coming from the Edinger-Westphal nucleus through the inferior division, through the nerve to inferior oblique, Then it will give preganglionic fibers that will relay or will synapse in the ciliary ganglion, and the postganglionic fibers will pass with the short ciliary nerves until it reaches the ciliary muscle and constrictor pupillae muscle. Okay, so let's now come to the trochlear nerve, which is the fourth cranial nerve. So the nucleus of the trochlear nerve, as we said, it is located in the midbrain, but on a lower level than that of oculomotor. So it is present at the lower level of midbrain or at the level of inferior colliculus. So where it is specifically located? It is located in the midbrain ventral to the aqueduct of Sylvius. Here is what's called the aqueduct of Sylvius, and this is important because the trochlear nerve will cause what's called decussation. So they will run around the aqueduct of Sylvius. So again, here is the trochlear nerve nucleus present ventral or more anterior to the periaqueductal Sylvian aqueduct. Here it is. This is the ocular, the trochlear. This is the trochlear nucleus, and here is the aqueduct of Sylvius. It is located more anterior. So here is the eye. So here we are anterior, while the cerebral aqueduct are more dorsal or more posterior. So what happens next? You can see that all cranial nerves emerge from the ventral surface of the midbrain or the ventral surface or anterior surface of the brainstem in converse to the trochlear nerve. So the trochlear nerve will pass posteriorly to emerge from the dorsal surface of the midbrain. So the vesicle will consist of axons that will curve posteriorly and decussate around the cerebral aqueduct in the anterior medullary velum. Then they will leave the midbrain or they will leave the brainstem just caudal or just inferior to the inferior colliculus to run between the posterior cerebral artery and the superior cerebellar artery. So here is, you remember, is the third nerve arising from the interpeduncular fossa. However, the trochlear nerve takes a different course. So they arise ventral to the aqueduct of Sylvius, then they run posteriorly, then lead to decussation. So the right trochlear nucleus will decussate to the left side, while the left trochlear nucleus will decussate to the right side. Both of them will decussate and then will emerge from the anterior surface of the midbrain. So once the trochlear nerve is emerged, it will again run between the posterior cerebral artery and the superior cerebellar artery, likewise the third nerve. So both of the oculomotor and the trochlear will run between the posterior cerebral and superior cerebellar artery, as we can see here. But the difference is that the third nerve emerges directly from the ventral surface, while, as you can see here, the trochlear nerve is coming from the back of midbrain, as it causes decussation around the aqueduct of Sylvius. A nice section here again. This is the trochlear nucleus, and here it causes decussation, and it runs from the back toward anteriorly. So it will run between the posterior cerebral artery and the superior cerebellar artery. So here is the trochlear nerve. It's present in the midbrain, or in the basilar part. Then it will enter the intracranial cavity to reach the cavernous sinus. In the cavernous sinus, it will run on the lateral wall of the cavernous sinus. In the beginning, it will be below the third nerve, but as it passes through the cavernous sinus, it will cross above the third nerve. So at the start, it will be below the third nerve and just above the ophthalmic nerve, which is the first division of trigeminal nerve. Then as it crosses through the cavernous sinus, it will pass superiorly, and it tries to emerge above the third nerve to reach the superior orbital fissure, and then it will emerge above the annulus of Zen. So here is again the fourth cranial nerve causes decussation and turn around the brainstem to enter the cranial cavity, and then it enters the lateral wall of the cavernous sinus. As it enters the lateral wall of the cavernous sinus, it is located between the oculomotor nerve and the first division of trigeminal nerve, which is the ophthalmic. So here is the trochlear nucleus passing into the lateral wall of the cavernous sinus. Then it will enter the superior orbital fissure, and it pass above the annulus of Zen. So it doesn't enter the tendinous ring or the annulus of Zen. It is present here in the lateral wall of the cavernous sinus, as you can see here, between the oculomotor nucleus and or the oculomotor nerve and the ophthalmic nerve. So here what I have just mentioned to you. Here is the third nerve as it passes through the cavernous sinus, and then it will divide. Here is the third nerve. It will be first above, and here is the fourth cranial nerve. It will be below the third nerve at the start. So the fourth nerve will be located between the third and the first division of the trigeminal, which is this one. Then the fourth cranial nerve will cross above the third nerve to emerge from the upper aspect of the cavernous sinus. Here it is. So it will cross the third nerve, then to enter the superior orbital fissure just above the common tendinous ring. So it is present in the superior orbital fissure, but not within the annulus of Zen. So why does the trochlear nerve take this course? This is because the trochlear nerve will eventually supply the superior oblique muscle, which is the muscle located at the upper corner of the orbit between the roof and the medial wall. That's why the trochlear nerve will take this ascending course. In the intraorbit, it will pass anteriorly and medially above the oculomotor nerve, the levator palpebrae, and the superior rectus muscle to supply the superior oblique muscle from its orbital surface. So here is the trochlear nerve passing above the levator and the superior oblique muscle to supply above the levator and superior rectus to supply the superior oblique muscle from its bulbar surface. To summarize some important features about the fourth or the trochlear nerve, that it is the only cranial nerve that will emerge from the dorsal aspect of the brain, as all other cranial nerves emerge from the ventral aspect, as we can see here. It is across the cranial nerve, meaning that the fourth nerve nucleus will supply the contralateral superior oblique muscle. So the right trochlear nucleus will supply the left superior oblique and vice versa. So here we can see this is the right trochlear nucleus. It will decussate, and the left trochlear nucleus will decussate. So they will supply each nucleus will supply the contralateral superior oblique muscle. Then this nerve is very long and slender, and this is why the most cranial nerve that is liable to trauma from head trauma. So if a patient received a trauma to the back of the head, what will be the most cranial nerve that is liable to trauma or liable to palsy? This will be the trochlear nerve. This is because it is very thin, or it is the most slender, and it runs on the back of the brainstem, so it is more superficial and more liable to trauma, as you can see here. Finally, the trochlear nerve nuclei are connected with what's called the medial longitudinal fasciculus to the oculomotor nucleus that will control the vertical eye movement together with the oculomotor nucleus. So the medial longitudinal fasciculus topic will be discussed in details in the physiology. So this is like a connection between different ocular cranial nerves, like the third and the fourth and the sixth, that will manipulate and conjugate the extraocular muscle movement together. So for example, if someone wants to look upward or look downward, then this patient or this individual will need to stimulate his superior oblique and the inferior rectus they should work simultaneously in order to look downward because they are both depressors of the eye. So what will make these muscles work together in the same degree? It will be the medial longitudinal fasciculus. So this will be, as I told you, this will be discussed in the physiology. So you don't have to think about it now. The final ocular motor cranial nerve will be the abducent nerve or the sixth cranial nerve. So, as usual, let's know where is the nucleus located. Now we can leave the midbrain to descend further through the pons to find that the nucleus of the abducent nerve is located at the lower level of pons. So here is the nucleus of the abducent nerve, present at the lower level of pons. However, this is an important feature here, which is that the facial nerve here, or the facial nerve nucleus, as you can see, the fibers of the facial nerve nucleus will curve backward and rotate around the sixth nerve nucleus to emerge as facial nerve. This rotation or this course of the facial nerve around the abducent nucleus, it is called the facial colliculus. So the facial colliculus, it is an elevation in the floor of the fourth ventricle caused by the curved course of the facial nerve around the nucleus of the abducent nerve. Here we can see again, here is the abducent nucleus present at this is the floor of the fourth ventricle at the level of lower pons, and here is the facial nerve or the facial nucleus will curve backward to rotate around this abducent nucleus causing the facial colliculus. So what happens next? Then the abducent nerve will pass through the pons. It will pass ventrally or anteriorly to leave the brainstem at the junction between the pons and the medulla. So here is the pons and the medulla. The junction between them is called the pontomedullary junction. So the abducent nucleus will pass ventrally to be located or to emerge from the brainstem through the pontomedullary junction. Again, here is the sixth cranial nerve nucleus, and it will pass ventrally to emerge from the pontomedullary junction. Then it will enter into the cranial cavity. As you can see, here is the abducent nucleus again, and here is the facial colliculus, facial nerve nucleus, curving around the abducent nucleus. So here we come to the basilar part. So the basilar part will curve upward to enter the base of a skull, crossed by the anterior inferior cerebellar artery, not the superior cerebellar artery. Just make sure of the manipulations of words. So the tricks sometimes here will become anterior inferior instead of superior. So just make notice of this this artery. Then it will pierce the dura below the posterior clinoid process to cross the apex of petrous bone. Then it will enter the cavernous sinus. So you can see here the sixth cranial nerve will cross forward or it will elevate or ascend. It will cross the anterior inferior cerebellar artery. Then it will enter the cavernous sinus. It crosses the posterior clinoid process here, and it will enter above the apex of the petrous bone below what's called petrosphenoidal ligament or Gruber's ligament. So here, the sixth cranial nerve will be crossed by the anterior inferior cerebellar artery, and it emerges from the brainstem at the medullary or the pontomedullary junction. Then it will pass above the posterior clinoid or at the level of posterior clinoid process. Then it will run over a sharp edge of the petrous bone. It's called the edge or apex of the petrous bone, just below a ligament called the petrosphenoidal ligament or Gruber ligament. So, and this will have an important clinical consideration, and that we will discuss later on. So again, here is the sixth nerve. This sixth nerve will emerge from the pontomedullary junction, crossed by the anterior inferior cerebellar artery, will run below the petrosphenoidal ligament here over the apex of the petrous bone. Then it will enter the cavernous sinus. In the cavernous sinus, it has a specific relation and important relation to the internal carotid artery, as it runs infralateral to the internal carotid artery at a lower level than the third and fourth cranial nerve and the ophthalmic nerve. So here is a section of the cavernous sinus. So you can see this is the third cranial nerve, this is the fourth cranial nerve, and here is the sixth cranial nerve running inferior and lateral to the internal carotid artery. So if we take a coronal section of the cavernous sinus, we can find that this is the third and the fourth, the first division of trigeminal, the second division of trigeminal, while this is the internal carotid artery, and here is the abducent nerve running infralateral to the internal carotid artery. After leaving the cavernous sinus, the abducent nerve will enter the superior orbital fissure within the annulus of Zen. It will be between the two heads of lateral rectus muscle because it will eventually supply the lateral rectus muscle from its bulbar surface. So here is the abducent nerve. The abducent nerve will enter the superior orbital fissure within the annulus of Zen. Then it will pass through the bulbar surface of lateral rectus muscle here and there to supply it, because this is the nerve supply of lateral rectus. Now we come to some important features of the sixth cranial nerves. So this cranial nerve has the longest intracranial course of any motor nerve of the eye. So just let me ask you a question. If it is asked you in the exam, what will be the most or the longest cranial nerve? What will be your answer? Again, the question will be, what is the longest cranial nerve? Just think more broadly. I'm asking about what is the longest cranial nerves, not what is the longest ocular cranial nerve. No. So the longest cranial nerve is the vagus nerve. It is the 10th cranial nerve, because this nerve will descend downward through the neck until it reaches the cardiac muscle and the level of bronchi, and it will supply different structures in the thorax. So yes, this is the longest cranial nerves, not the ocular cranial nerves, and this is a common question in the exam. So just focus on what is written specifically in the question. Okay, so the abducent nerve then makes a sharp turn over the petrous bone, and this makes it vulnerable to trauma, but it is less vulnerable than that of the trochlear nerve. So the trochlear nerve will be the most vulnerable nerve to trauma. This is for MCQ. But this abducent nerve, it is the most cranial nerve that is liable to trauma or liable to lesion by increasing in the intracranial pressure. So if there is a brain space occupying lesion like a brain tumor that will cause increased intracranial pressure, this will lead to stretch of the abducent nerve over the sharp edge of petrous bone, and this will lead to palsy of the sixth nerve. So it is very common to find the patients who have papilledema due to increased intracranial tension. Don't forget to test for ocular motility to check for abducent palsy, because this nerve is very liable to palsy from increased intracranial pressure. So as you can see here, the nerve is stretched over the sharp edge of the petrous temporal bone. So it's become liable to trauma or liable to palsy from increased intracranial tension. Then, if there is a destructive lesion that will destroy the nucleus of the third nerve, this will not only impair the lateral rectus action on the same side, but it will impair adduction of the medial rectus on the other side. This is because the sixth cranial nerve, it is connected with the third cranial nerve through the medial longitudinal fasciculus again. And as I told you, this will be discussed in more details in the physiology. So just to know now that the third cranial nerve and the sixth cranial nerves are both together connected with a structure called medial longitudinal fasciculus. If there is a destructive lesion that will cause damage to the abducent nerve root, then this will lead to only palsy to the lateral rectus. However, if there is a damage to the abducent nerve at the level of nucleus or a nuclear lesion, then this will lead to damage of the facial nerve as well, because both of them rotate around the abducent nucleus, causing the facial colliculus. So if there is a lesion causing or a tumor, for example, causing compression of the sixth nerve nucleus, this will damage the facial as well. That's why if we have an isolated nerve, sixth nerve palsy without any facial component, then it is never nuclear in origin, because it is very close to the facial nerve. So these are the ocular cranial nerves or ocular motor cranial nerves. Is everything clear up till now? Do you have any question? Okay. So let's now move to the mixed nerves. So we have two mixed nerves. One of them, it will be the trigeminal, having a motor and sensory component, and the other one will be the facial nerve, having motor, sensory, and parasympathetic component. So let's start with the trigeminal nerve. So it's a mixed nerve, as we just mentioned, consisting of motor component and sensory component. The motor part of a trigeminal nerve will supply the muscles of mastication, supply tensor tympani and tensor palati muscle, and the anterior belly of digastric muscle. On the other hand, the sensory component, which consisting of the maxillary, the mandibular, and the ophthalmic nerve, will supply the anterior half of the scalp, supplying the face, the orbit, and the oral cavity. So let's start first with the nuclei of the trigeminal nerve. The nuclei of trigeminal nerves are divided into motor nucleus and the sensory nuclei. The motor nucleus are located here in the pons, at the mid-level of pons. So this is the muscle which is this is the motor nucleus that is responsible for motor or supplying the motor muscles that we have just mentioned. On the other hand, we have the sensory nuclei. So the sensory nuclei are a long nucleus extending from the midbrain till the spinal cord. So we need to know which are these sensory nuclei, what is the location of each one of them, and what is the sensation is responsible from each one of them. The first one, which is the highest one present at the level of midbrain and the upper pons, is called the mesencephalic nucleus. So the mesencephalic nucleus, it is responsible for proprioception. Proprioception, so this proprioception meaning that it is the deep sensation, so you will be able to know what is the level of muscles in the space. But without opening your eyes. So this receives proprioceptive sensation from muscles of mastication. So for example, if you are closing your eyes and opening your jaw, you will be able to know that your jaw is opened, or it is and this is because of proprioception, and this transmitted by the mesencephalic nucleus. Then we have the main sensory nucleus, which is present at the mid-pons, at the level of the main motor nucleus or the motor nucleus. The main sensory nucleus present at the mid-pons, which is responsible for touch sensation. So if someone touches you in the face, then this sensation is received by the main sensory nucleus. Finally, we have a long nucleus that will take up from the lower bones till the medulla until upper two segments of the spinal cord. This nucleus, it is called the spinal nucleus, since it has an extension to the spinal cord. It's called sensory nucleus, and this nucleus will be responsible for pain and temperature sensation. So again, to summarize, we have the motor nucleus, we have the sensory nuclei divided into mesencephalic nucleus responsible for proprioception, the principal sensory or the main sensory nucleus present in the midbones responsible for touch, the spinal nucleus extending from the lower bones and the medulla and the upper two segments of the spinal cord, which is responsible for pain and temperature. I don't understand, Dr. Rasha. What do you mean by what happened? Is there any something wrong? So I guess it's a problem at your side, Dr. Rasha, because everything or other candidates can see and hear me well. Your internet connection is fluctuating. Okay, so here are the nuclei of the trigeminal nerve. Then after the trigeminal nerve will emerge from the bones by two roots. The larger one, the larger one, will be the sensory root, and has a smaller one, which is the motor root. Both of them will emerge from the brainstem. Then they will not penetrate the dura immediately to enter the cranial cavity, but they will push the dura in front of it for a little space, forming a pocket. It's called a dural pocket made from the dura. It's called the cavum trigeminal. Cavum trigeminal, it is a dural pocket that is occupied by the trigeminal ganglion. So again, the sensory and the motor nerve will emerge from the brainstem. Then they will enter through the cavum trigeminal, which is occupied by the trigeminal ganglion formed from the sensory roots of the trigeminal nerve. The trigeminal ganglion, or what's called the Gasserian ganglion or semilunar ganglion, it's a crescent-shaped mass of cells present in the cavum trigeminal within the petrous bone that has two borders. The posterior concave border attached to the sensory root, while the convex anterior border will be divided into three terminal branches, which are the ophthalmic, the maxillary, and the mandibular nerve. You can see that clearly that the motor root, which is the blue one, is lying inferiorly, so it will pass below this the ganglion, so it doesn't enter the Gasserian ganglion, and it pass, and then it will descend in close proximity to the mandibular nerve, as it will join the inferior division or the mandibular nerve. Just hold on for a second to recharge my laptop. Okay. So here again, we have the sensory root that is attached to the trigeminal ganglion, divided into the ophthalmic nerve, the maxillary nerve, and the mandibular nerve. And we have here the motor nerve, which pass with the mandibular nerve. So let's have more information about the terminal divisions of the trigeminal nerve. The first division will be the ophthalmic nerve. So the ophthalmic nerve will start at the trigeminal ganglion as the first division of the trigeminal nerve, passing forward to lie in the lateral wall of the cavernous sinus between the fourth cranial nerve and the maxillary nerve. So here is the trigeminal ganglion, and here is the first division of the trigeminal nerve or the ophthalmic nerve, passing in the lateral wall of cavernous sinus. Then Just posterior to the superior orbital fissure, it will divide into its terminal branches. These terminal branches are the frontal nerve, the lacrimal nerve, and the nasociliary nerve. As we said in the orbit lecture, we said that the frontal nerve and the lacrimal nerve are passing above the annulus of Zen, while the nasociliary nerve enter through the annulus of Zen. Remember, live free to really see no insult at all. So live for lacrimal and free is for frontal. So both of lacrimal and the frontal nerve will enter the orbit above the annulus of Zen within the superior orbital fissure. However, the nasociliary nerve will enter the superior orbital fissure through the annulus of Zen. As you can see here, this is the lacrimal, and this is the frontal. It will enter the superior orbital fissure above the annulus of Zen, while the nasociliary nerve enter within the annulus of Zen. So, what are the nerve supply of the lacrimal, the frontal, and the nasociliary nerve? The frontal nerve will be the largest one of the terminal branches of the ophthalmic nerve. So the frontal nerve, it will, from its name, will supply the areas of the frontal surface or the forehead. So this frontal nerve will pass just below the roof of the orbit or lying above the levator palpebris superiosus muscle. So it will running superiorly. Then it will divide into its terminal branches, which are the supratrochlear nerve and the supraorbital nerve. These nerves will supply, the supratrochlear nerve will supply the medial aspect of the upper eyelid and the upper conjunctiva and the medial scalp, while the supraorbital nerve will supply the middle aspect of the lid, upper lid, and the upper conjunctiva, palpebral conjunctiva, and the scalp. Then we have the nasociliary nerve. So it's a medium size. It runs with a close proximity to the ophthalmic nerve, as with the ophthalmic artery, as we said in the last lecture, crossing above the optic nerve. Then it will give different branches. First, it will give a sensory route to the ciliary ganglion. Then it will give the two long ciliary nerves that will penetrate the back of the globe at the 3 and the 9 o'clock positions to supply the dilator pupillae muscle as a sympathetic supply. It gives anterior and posterior ethmoidal nerves to supply the ethmoidal sinuses, and it gives the infratrochlear, or continue as infratrochlear nerve that will supply the medial aspect of the lower eyelid and lower conjunctiva. The final branch, or the third branch of the ophthalmic nerve, will be the lacrimal nerve. So the lacrimal nerve will be the smallest one of all of these branches of ophthalmic nerve, passing above or running over the superior border of the lateral rectus, as it wants to reach its final destination, which will be the lacrimal gland. The lacrimal nerve will receive a communicating branch from the zygomatico-temporal nerve coming from the maxillary nerve, as we said before, that will be a secretory and a parasympathetic supply to the lacrimal gland. So the lacrimal nerve will receive parasympathetic fibers from the zygomatico-temporal nerve to the lacrimal gland. Also, the lacrimal nerve will supply the lateral aspect of the upper eyelid and the upper conjunctiva, and the lateral aspect of the lower eyelid and lower conjunctiva. The second branch of the trigeminal nerve will be the maxillary nerve. So the maxillary nerve starts from the trigeminal ganglion, as we know. Then it will pass forward. It will give meningeal branches to supply the meninges. Then it will enter the foramen rotundum. After entering the foramen rotundum, it will pass through the fossa called the pterygopalatine fossa. In the pterygopalatine fossa, there will be an important and the largest parasympathetic ganglion in the head and the neck. It's called the sphenopalatine ganglion. So the maxillary nerve will give two sensory routes to the the sphenopalatine ganglion at the infratemporal fossa. Then it will run forward in the inferior orbital fissure. It passes through the inferior orbital fissure to divide into the zygomatic nerve and the infraorbital nerve. So the infraorbital nerve will pass into the infraorbital canal to emerge from the infraorbital foramen below the inferior margin to emerge in the cheek as infraorbital nerve. Why the zygomatic nerve will be divided into the zygomatic-temporal nerve and a zygomatic-facial and zygomatic-temporal nerve that will emerge from the zygomatic-temporal foramen and zygomatic-facial foramen. So here we are, the infraorbital nerve passing through the infraorbital fissure, then it will enter the infraorbital canal, then will emerge from the infraorbital foramen as infraorbital nerve. They will give branches to the alveoli or the teeth that are anterior and middle and posterior superior alveolar nerves. Also, they will receive or give terminal branches to supply the skin and the conjunctiva of the lower eyelid. So they will supply the middle part of the lower eyelid and lower conjunctiva. The zygomatic nerve will be divided into the two branches, the zygomatic-temporal and the zygomatic-facial nerve. And bear in mind that we said that the zygomatic-temporal nerve will give a nerve supply or will gland to the lacrimal nerve to the lacrimal gland. Here we can see. Here is the maxillary nerve. It will give the meningeal branch before it enters through the foramen rotundum. Then, as it passes through as it emerges from the foramen rotundum, it will pass through the infratemporal fossa. Here, this is the temple, and this is the infratemporal fossa, and it will find that there is a ganglion called the sphenopalatine ganglion located into the sphenopalatine fossa, or the pterygopalatine fossa. So it will give two sensory branches to it. Then it will enter the inferior orbital fissure to divide into the zygomatic nerve and the infraorbital nerve. And here are some branches of the infraorbital nerves to the alveoli. Finally, we have the facial nerve. The facial nerve, it is one of the mixed nerves, so it has a motor component and sensory component and parasympathetic component. The motor components will be supplying the muscles of the face, while the sensory component will receive taste sensation from the anterior two-thirds of the tongue, the soft palate, and the floor of mouth. The parasympathetic supply will be mainly to lacrimal gland and salivary glands, specifically the sublingual gland and submandibular gland, and some oropharyngeal glands like palatine glands, nasal glands, and the nasopharyngeal glands. As usual, let's start with the nuclei. So what are the nuclei of the facial nerve? Facial nerve has has motor nucleus, sensory nucleus, and the parasympathetic nuclei. So the motor nucleus, it is called the facial motor nucleus. It is located at the lower bones and supplies the muscles that are derived embryologically from the second brachial arch. While the sensory nucleus, it is called the nucleus solitarius. This nucleus solitarius present at the medulla. As you can see, it is present here at the lower level. And it receives the taste sensation from the anterior two-thirds of the tongue through the chordotympani nerve. Then we have the parasympathetic nuclei, specifically the lacrimatory nucleus and the superior salivatory nucleus. So the lacrimatory nucleus will give the parasympathetic fibers to the sphenopalatine ganglion to the lacrimal gland, while the superior salivatory nucleus will give the parasympathetic fibers to the salivary glands. So it will give the submandibular, sublingual, and the palatine, nasal, and the nasopharyngeal glands. So what will be the course of the facial nerve? So the facial nerve will emerge by two routes, the motor route and the nervus intermedius. So here is the motor route. The motor route after the facial colliculus, or the facial nucleus made the facial colliculus around the nucleus of the sixth nerve. It will then emerge at the cervicomedullary junction. Sorry, at the cerebellopontine junction to enter the from the brainstem at the inferior border of the pons, just lateral to the abducent nerve. So here is the nervus intermedius, and here is the motor nucleus or the motor route. Once it is emerged from the brainstem, it will pass into the posterior cranial fossa to enter the internal auditory meatus to reach what is called the facial canal. So here is the facial canal extending from the internal auditory meatus here. It will run through the internal auditory meatus and into the facial canal. Then it will descend downward, as you can see here, just behind the middle ear until it reaches the stylomastoid foramen. Below the stylomastoid foramen, the nerve will turn anterior to the base of styloid process to enter the parotid gland. And when the parotid gland, it will divide into its terminal branches, into its 5 terminal branches, which are the temporal, zygomatic, buccal, mandibular, and cervical. So again, the facial nerve will leave the brainstem at the cerebellopontine junction as a nervous intermediate and the motor nerves. They will pass auditory meatus just behind the middle ear in the facial canal. Then they will leave the facial canal, descend downward to enter the stylomastoid foramen. Then it will leave the stylomastoid foramen to curve anteriorly and enter the parotid gland. And in the parotid gland, they will divide into its terminal branches, which are the temporal, zygomatic, buccal, mandibular, and cervical. So what will be the branches? In the facial canal, it has 3 branches. The greater petrosal nerve, or the greater superficial petrosal nerve, which originates from the geniculate ganglion. It is present in the pterygopalatine fossa, or it will relay in the pterygopalatine fossa because it is a parasympathetic ganglion to give postganglionic fibers that pass with the zygomatic-temporal nerve to lacrimal gland. Also, it will give a nervous to stapedius muscle, and it will give the sensory nerve, which is the chordotympani nerve, and that has both sensory and parasympathetic fibers. So they give preganglionic parasympathetic fibers that will relay into the submandibular ganglion. Then the postganglionic fibers will supply the sublingual and submandibular salivary glands. And also just bear in mind that the parotid gland will receive its innervation from the lesser petrosal nerve, not from the greater petrosal nerve. Also, there is sensory fibers that will pass in the chordotympani nerve that will receive sensation from the anterior 2/3 of the tongue. So again, in the facial canal, what will be the branches of, here is the facial canal. What will be the branches of the facial nerve? The first one will be the greater superficial petrosal nerve. It will relay in the pterygopalatine ganglion. Then the postganglionic fibers will join the maxillary nerve and the zygomatic-temporal nerve and lacrimal nerve to parasympathetic supply of lacrimal gland. Also, other fibers will pass with the also it will give a nerve to the stapedius muscle. Here is the geniculate ganglion, and it will give the nerve to stapedius muscle. Here it is. And finally, it will give the chordotympani nerve. So the chordotympani nerve has 2 types of fibers. Has parasympathetic fibers that will relay into the submandibular ganglion to supply the submandibular glands, salivary glands, and sublingual glands. Also, it has sensory fibers that will receive sensation from the anterior 2/3 of the tongue. So what are the branches of the facial nerve after leaving the facial canal? So it will, after leaving the facial canal, it will descend below the stylomastoid foramen. So it will give some muscular branches or some motor branches. So it will give branches that will supply the posterior belly of digastric nerve to the stylohyoid muscle, posterior auricular nerve, and the terminal branches inside the parotid. There will be upper trunk and lower trunk. As we can see here, here is the facial nerve descending below the stylomastoid foramen, and it will give the branches to the digastric muscle, which is the posterior belly of digastric, and the posterior auricular nerve. And then within that parotid gland, it will receive or divide into its terminal branches. Like upper division will be the temporal nerve and zygomatic nerve, and lower division, which will be the buccal, and the cervical and maxillary buccal nerve. Okay, so for the ciliary ganglion, this is the branches of the and the final branches of the facial nerve. Finally, we have some ganglia. There are in the sympathetic and the parasympathetic ganglions related to the eye, or that give supply to the eye. We have two parasympathetic ganglia, which are the ciliary ganglion and the sphenopalatine ganglion, and one cervical ganglion, one sympathetic ganglion, which is the superior cervical sympathetic ganglion. So let's first discuss the ciliary ganglion. The ciliary ganglion is the smallest parasympathetic ganglion for the head and the neck. It is about 1 to 2 millimeters, located about 4 millimeters behind the globe, in between the lateral rectus and the optic nerve. So we need to know for each ganglion what are its input and what will be the output. What are the nerves that will supply this ganglion, and what will be the nerves that will emerge from this ganglion to supply which structures of the eye, and which one of these nerves that will relay or synapse within this ganglion. So as a general rule, or as a rule of thumb, this nerve or this ganglion is a parasympathetic ganglion. So only parasympathetic nerves or only parasympathetic fibers will relay or will synapse in this ganglion. So we have this ganglion will receive three roots or three fibers, three types of fibers. It will receive sensory nerves, sympathetic nerves, and the parasympathetic nerve. So as we know now, only the parasympathetic nerve will relay. So this parasympathetic nerve will come from which nerve? Will come from the oculomotor. As we said, the oculomotor will give the nerve to inferior division, then it will give the nerve to inferior oblique. So the preganglionic parasympathetic fibers will pass with the nerve to inferior oblique to relay into the ciliary ganglion. Then this nerve will pass through the short ciliary nerves to supply the ciliary muscle and the constrictor pupillae muscle. So this is the parasympathetic. We have sensory root. So this sensory root coming from the nasociliary nerve. The sensory root coming from the nasociliary nerve will pass without relay through the ciliary ganglion, and it will supply the posterior part of the sclera and the iris and the cornea. Then finally we have the sympathetic root. The sympathetic root again will pass with the nasociliary nerve. Then it will enter through the ciliary ganglion without relay. That will supply a sympathetic that will give sympathetic supply to the choroidal blood vessels. So only parasympathetic that will relay in this ganglion. Then we have the sphenopalatine ganglion. The sphenopalatine ganglion will be the largest ganglion present in the head and neck. It is located in the pterygopalatine fossa, as you can see here. And as we can see, it has a nerve and or has sensory roots and sympathetic roots and the parasympathetic roots. So let's see the sensory root coming from which nerve? It will come from the maxillary nerve. So the maxillary nerve, as a rule, as we said, only the parasympathetic fibers will relay. So other nerves will not relay. So sensory nerves coming from the maxillary nerve, then through then it will descend throughout the pterygopalatine ganglion without relay to supply the oral periosteum and the nasal mucous membrane and the nasopharynx. So the sensory fibers from maxillary nerve will not relay in the pterygopalatine ganglion. Then we have the sympathetic, and the sympathetic will come from the sympathetic plexus around the internal carotid artery to join the deep petrosal nerve that will join the greater superficial petrosal nerve to enter the pterygoid canal as median nerve. Then it will pass through the pterygopalatine ganglion without relay. So it will pass through the zygomatic nerve and the zygomatic-temporal nerve, and it will join the lacrimal nerve to the lacrimal gland. But this is a vasomotor, so this will be to the blood supply of lacrimal gland, and doesn't have a secretory function and doesn't relay in the pterygopalatine ganglion. Finally, we have the greater superficial petrosal nerve that will pass with the deep petrosal nerve through the pterygoid canal as a nerve of pterygoid canal or medial nerve. Then it will pass through the pterygopalatine ganglion, and it will find that the pterygopalatine ganglion is a parasympathetic ganglion, so it will relay here. As it will relay, the postganglionic fibers will join the maxillary nerve and the zygomatic-temporal nerve to join the lacrimal nerve to supply the lacrimal gland. Also, it will give some fibers that will supply nasal and the palatine and the nasopharyngeal glands. So, after we know the roots of the pterygopalatine ganglion, let's know what are the branches. So here is the pterygopalatine ganglion. Parasympathetic fibers that will supply the lacrimal gland, as we mentioned earlier. We have the greater and lesser palatine nerves that will supply the palatine glands. We have the long and short sphenopalatine nerves that will supply the nasal glands. And finally, we have the pharyngeal branches that will supply so what are the structures in the eye that are supplied by the parasympathetic system? So we have just mentioned them. We don't need to memorize a lot because we have just mentioned them more than once. So we have the light pathway or the pupillary pathway or the pupillary light reflex and the lacrimal gland. So what is the pupillary light reflex that will receive the parasympathetic supply? It will be emerging from the Edinger-Westphal nucleus. So this will be the center. The preganglionic fibers will pass with the oculomotor nerve to supply, then it will enter the superior orbital fissure to pass into the inferior division of the oculomotor nerve. Then it will pass through the nerve to inferior oblique until it reaches the ciliary ganglion. In the ciliary ganglion, it will synapse. Then the postganglionic fibers will emerge from the ciliary ganglion to pass with the short ciliary nerves until they reach the ciliary muscle and the constrictor pupillae muscle. This will stimulation by light of this pathway will cause constriction of the pupil. The second structure will be the lacrimal gland. So the lacrimal gland will be supplied from the lacrimatory nucleus present in the fourth floor of the fourth ventricle that will give nervous, the preganglionic fibers will pass with the nervous intermedius that will then pass through the geniculate ganglion but without relay because this is not its ganglion. Then it will pass through the greater superficial petrosal nerve as we mentioned in the lacrimal lecture. So this is it will arise from the parasympathetic nuclei through the nervous intermedius to the geniculate ganglion without relay. Then it will pass through the greater superficial petrosal nerve. From then, the preganglionic parasympathetic fibers will join the nerve of pterygoid canal or median nerve. Then it will pass through the sphenopalatine ganglion to synapse. Then it will pass with the postganglionic parasympathetic fibers will join the maxillary nerve to the zygomatic-temporal nerve and lacrimal nerve to finally supply the lacrimal gland. As you can see here, the greater superficial petrosal nerve to the nerve of pterygoid canal that will pass to the pterygopalatine ganglion where it relays. Then the postganglionic fibers will reach the maxillary nerve to pass into the zygomatic-temporal nerve. Then it will reach the lacrimal nerve to supply the parasympathetic supply, the secretomotor supply to the lacrimal gland. Finally, the final part of the first lecture will be the sympathetic system. So what is the source of sympathetic supply to the eye and what are the structures supplied by sympathetic system in the eye? Here is an illustration that outlines the sympathetic pathway. Sympathetic pathway starts by what's called first order neuron, which is present in the hypothalamus or the posterior hypothalamus. From the first order neuron, fibers descend through the brain and neck and thorax until it reaches the second-order neuron, which is called the ciliospinal center of Budge, which is located at the lateral horn cells of a spinal cord between the eighth cervical vertebrae to the second thoracic vertebrae. So along all these four segments of the spinal cords, the second center or the second order neuron of the sympathetic fibers is located. From the ciliospinal center of Budge, from C8 to T2, the preganglionic fibers pass again, arise along the neck to reach the superior cervical ganglion. And here it relays because this is a sympathetic ganglion. Then the postganglionic fibers arise from the superior cervical ganglion to be distributed along the course of internal carotid artery. And from then, the fibers of sympathetic fibers will join different nerves to be arranged or to be distributed to the different structures of the face and eye. So where will be the fibers of the sympathetic system will be distributed? First of all, we have just mentioned in the, as we were discussing the ciliary ganglion, that the nasociliary nerve will carry sympathetic route to the ciliary ganglion, but it will not relay, and it will pass with the short ciliary nerves to the choroidal blood vessels. So this will be one division. Also, through the nasociliary nerves, the sympathetic fibers will join two long ciliary nerves, which pass within around the optic nerve, and which will pass into the suprachoroidal space until they reach the dilator pupillae muscle. So they will supply the dilator pupillae muscle, which is responsible for pupil dilatation. Then also the sympathetic fibers will give a branch that will pass with the oculomotor nerve to specifically to nerve to levator muscle that will supply a small muscle arising from the levator, which is the molar muscle or the superior tarsal muscle. Also, there are some fibers that will pass from the sympathetic system to the ophthalmic artery that will pass with the medial and lateral palpebral arteries, branches of the ophthalmic artery, to supply the lid and conjunctival blood vessels. So to summarize, here is the hypothalamus or the first order neuron. Fibers will descend downward to the second order neuron, which is present at the lateral horn cells of the spinal cord from C8 to T2 or ciliospinal center of Budge. From this C8 to T2, fibers will rise again through the neck, or the preganglionic fibers will relay in the superior cervical ganglion, and from then the postganglionic fibers will pass through the internal carotid artery to be distributed along with the distributions of internal carotid artery and other nerves. So, for example, they will pass with the nasociliary nerve to the nasociliary ganglion without relay to supply the choroidal blood vessel. Also, it will pass with the nasociliary nerve to supply the long ciliary nerves, and the long ciliary, it will pass. The first one will pass through the short ciliary nerves, which will not relay, and will pass with the long ciliary nerves, and the long ciliary nerves will enter the suprachoroidal space and the supraciliary space to supply the dilator pupillae muscle. And also, it will pass with the oculomotor nerve to supply the with the nerve to the levator palpebrae superioris to supply the molar muscle, which is a superior tarsal muscle. And then finally, it will give a branch that will pass with the ophthalmic artery to the medial and lateral palpebral arteries that will supply blood vessels of lid and conjunctiva. This is a good section because it can also illustrate the parasympathetic supply to the eye. So from the center of the parasympathetic supply will be the Edinger-Westphal nucleus. From the third nerve, the preganglionic will pass with the oculomotor nerve to the inferior division of the oculomotor nerve to the nerve to inferior oblique that will relay, the preganglionic fibers will relay in the ciliary ganglion. Then it will pass, the postganglionic fibers will pass with a short ciliary nerve to supply the constrictor pupillae muscle and the ciliary muscle. While the sympathetic fibers, so this is the sympathetic fibers to the lid and the conjunctiva and the molar muscle and the dilator pupillary muscle. The final division of the sympathetic fiber will be to the lacrimal gland. So as we said earlier, the sympathetic gland will receive a sympathetic supply. So what will be the course? It will the postganglionic fibers around the internal carotid artery will pass with the deep petrosal nerve to join the nerve of pterygoid canal that will pass through the pterygopalatine ganglion without relay, as it is already relayed in the superior cervical ganglion. Then it will pass with the maxillary nerve, then the zygomatic-temporal nerve to reach the lacrimal nerve, and finally it will supply the blood vessels of lacrimal gland. Here we can see that the sympathetic fibers from the internal carotid artery will pass with the deep petrosal nerve to join the greater superficial petrosal nerve to form the nerve of pterygoid canal that will pass with the pterygopalatine ganglion without relay. Then it will reach the maxillary nerve and the zygomatic-temporal nerve, and finally it will reach the lacrimal nerve and lacrimal gland. So this is the end of the sympathetic supply and the end of the nerve supply to the eye. Do you have any questions in the nerve supply of the eye?